and offering a different perspective that can come together I mean, I think one of the examples I often use is the vast amount of research that takes place on psychiatric drugs that doesn't take the service user perspective. We end up with a situation where people don't want to take the drugs because nobody listened to me. I said that this had this awful effect. I can't have sex anymore. I can't, you know, I'm gaining a lot of weight, but nobody was listening to service users. So, you know, then that will inevitably lead to poor, I think, very poor services, poor use of money, public funds, public money as well. So a lot of people are very frustrated with traditional research. Increasingly, that phrase "expertise by experience" is used in the UK, and I mean, maybe you've probably come across it. And just recognising that we all have a different expertise, and it may not be that, you know, it may be that some people are much more capable of, for example, getting involved in statistical analysis than other people, but you know, that's another thing that needs to be sort of picked out when you sort of bring together people to do the research together. Service users, in my experience, are much more interested in improving services or seeking change than many academics. I'll talk a bit more about dilemmas in a minute. I don't want to be completely anti-academic, because obviously what we want to do is work together, but there are occasions when I have had, you know, real difficulties, and since leaving Strategies for Living, those sort of golden days when we had so much sort of opportunity to do what we really wanted to do, and then coming out into the world and working much more with academics, I've realised how difficult it is sometimes to change attitudes, really. And I suppose it depends. I mean, often in the UK, I'm often working with you know, clinical academics, psychiatrists and so on, in institutions where they have a lot of power, and you're still dealing with some of the same power imbalance that you might have in mental health services when you go to together to try and change things. Arguably improving the quality of research. There's a new report out by Involve. There's a few copies on the table, but it's really looked at the impact of involving the public in research. Again, not just mental health, because they do work across the whole sort of spectrum of potential disciplines, but basically looking at what difference does it make when we involve service users, carers in research. What difference does it make to research in all sorts of different ways? And it's a really interesting report. I would really recommend it. It's actually really well written. I really would recommend that one. For service users and also for carers, skills, confidence and empowerment are things that are potentially gained from being involved in research. And I've certainly seen that happen myself. I mean, I've had a number of really wonderful experiences of working with people where people have really, their confidence has really blossomed, and they've gone on to do amazing other things since. Sometimes more research, sometimes doing something like getting advocacy or counselling skills. So it's not necessarily about research, but it's about, okay, we got involved in this thing as a group together and gained a huge amount from it. Challenging models of understanding. I personally feel it's a very valuable route into doing that. It can be really, that can be a much longer term project, really. The dominance of the medical model in mental health is something that I think many of us would quite like to have some impact on, and I certainly, you know, have had difficulty sometimes getting involved in research if it's very much a diagnostic-based thing, or, you know, rather than an applied sort of service-related or experience thing. But that's a personal, very much a personal choice, really. And then finally, just thinking about some of the issues affecting, you know, healthcare provision, use of public funds for research. It's very much, I think, a powerful argument that says that democratic and ethical, it's democratic and ethically sort of, you know, for people to sort of feel that the public have an influence over how the money is used, basically. Now finally then, I mean, in a way I think my slides are not quite in the right order here, because what I'd like to do then is to sort of think about the policy things that have taken place, and I don't think that's next on my list, but I will come back to it. But there have been some significant policy imperatives that have suggested service users and carers are to be involved in research. research and in service development and delivery. So that has been an enormous boon for us in the UK. But here's some views of some other people. This is somebody involved in a project some time ago, Sunset Spirituality Project, which emerged out of the Strategies for Living research. A very important piece of work, which may be of interest to people here. It was very much about how, for service users in mental health services in the UK, people who want to talk about religious beliefs and spirituality often are not listened to and dismissed, because it's something that people don't, doctors, nurses often don't feel comfortable about talking about it, and also tend to think that these beliefs, ideas, are potentially a symptom of the underlying mental illness, and so tend not to wish to engage with this subject again at all. And it's a theme that has become immensely, it has grown and grown as a theme. There's a whole project going on again now. But this was just one person that we interviewed who said something I think quite powerful. I won't read out his words, you can read them yourself. But really about wanting to be listened to. And that is really what I think a lot of this kind of research is about. There's a couple of researchers here talking about research into psychotherapy in this particular case. So there's some very positive hopes there, some very sort of hopeful, optimistic sort of hoping for change, really. Okay, so here's the policy initiatives that have been taking place in the UK. It goes back at least as far as 1999, probably before that even. The NHS and Community Care Act, which was 1990, did also talk about user and care involvement. Most significant for us, research governance framework for health and social care, which basically said that service users and carers should be involved in research. There's a couple of really useful paragraphs that we can use in the UK to say, look, this is what it says in the research governance framework, and that was quite an important part of the imperatives that began to make it possible. And also, in the mid-1990s, as I say, the organisation Involve was set up, which was an advisory group to the Department of Health. Now, we have, more recently, the National Institute for Health Research. As part of that, we have the Mental Health Research Network. I mean, this whole sort of bureaucracy is difficult to understand in the UK, never mind trying to tell you about it in Ireland, so I'm not going to carry on with that. But suffice it to say that within this Mental Health Research Network, there is a particular group that is there to support user and carer involvement in the Mental Health Research Network. So there is something very institutionalised now about user and carer involvement in research.